So again, the cases per 100,000 set the overall relative risk for that county. But the other categories, testing adequacy per 100,000, test positivity percentage, case fatality ratio, and then the overall health district hospitalization resources, also including ICU beds, also gives at a glance how that county is doing in these other areas, right? So one of the questions that we typically get is test positivity, and why does that matter? On its own, it doesn't matter. We've consistently had a very high test positivity rate. That number doesn't mean much if we don't understand if we're doing enough testing, right? So that suppression number is 580 tests per 100,000, right? Our health district, the counties in our health districts have consistently been able to test at that level, right? So that's really good. So we can look at that at a glance, and provided that, and if we go back and look at one of these profiles, let's just take Boone County, for example, we see that the testing adequacy per 100,000 is really good. It's really high. It's in that 580 category, but we still see test positivity being really, really high. That gives us a little bit of caution. Again, it doesn't overpower, if you will, the overall risk category for Boone County, which is orange at this point, based on cases per 100,000. But it just lets us know that people that are testing really high. That's likely that those that are being tested are symptomatic, but that's kind of what we've seen for the last 10 months. Case fatality ratio, we've begun comparing that to the state average. And so if it's 25% above, it is orange. If it's 50% or higher, based on the state average, then it's red, and likewise for blue and for green. We know what our hospitalizations are and what that looks like based on the number, and this isn't a percentage. This is the actual hospital bed numbers based on the COVID hospitalizations. We know that based on what our health district resources are, and so those are actual numbers. And then we know that we have 9 ICU beds in the 4 hospitals. And again, these are lumped together for our 4 hospitals. And so these overall numbers, both categories, will be the same across each county.
Are we going in the right direction?
Yeah, we have been. We started to see a little bit of a bump here post, like holiday, and time will tell if this is just a bump or if it's starting to hit into a bit of a surge. We predicted that we would be in a bump, that we would have a bit of a bump after holidays. And I think that we're starting to see that. We saw a bump after Thanksgiving. It was just a quick, brief bump. We see a bump every time we shift, DHMs. That's another time we see a bump. So we are seeing a little bit of an increase in cases. If you look at the data from last week. So we saw 125 cases over the last 7 days when pulled on Friday, compared to 73 cases the 7 days prior. And so, that's an indication of a bump, and time will tell if that's becoming a small surge, or if things will even back out. I am concerned that with DHMs, in blue, and the Columbus mask mandate, sort of sunsetting, I do expect that people will be less likely to wear masks. You're going to see more gatherings. I think that the conditions are right for a little bit of at least a small surge. I think that one of the things that we've seen though here in the last few weeks, maybe the last month, is up until this point, a lot of the cases were primarily younger folks, and that's certainly still true, but we are starting to see more of those that are 65 and older, and really 55 up, getting COVID at higher rates, and that has us concerned as we move forward.